Welcome back to Diabetic Foot Files. I'm Dr. D. Hope everybody's enjoying their Easter weekend. Today we're going to slow it down, no rushing, no shortcuts, because today we're going to talk about the wounds that have changed history. We're not talking about diabetic ulcers, and we're not talking about surgical wounds, not even pressure wounds. We're going to talk about the wounds of Jesus Christ, because yesterday was Good Friday, the Crucifixion, and that's the whole point. So, whether you're listening from a place of faith, a place of medicine, or just curiosity, you cannot deny that this is one of the most brutal physiological complex trauma cases you ever described. And if you ever watched The Passion of the Christ, you've seen it. It's very traumatic, to be honest. It's very detailed, traumatic. But today we're not just watching, we're going to be analyzing. So, let's start about the stress before the trauma. So, we're going to talk about the Jesus sweating blood. So let's begin before the violence, before the whip, before the nails. We start in the garden, okay? At a moment of extreme psychological stress. So what is described? They say Jesus is sweating blood. So let's break that down clinically. Hematohidrosis. It's rare, it actually is something, but it's documented condition where there is extreme stress that activates the sympathetic nervous system. The capillaries surrounding the sweat glands rupture and blood mixes with sweat and it exits through the pores. So the pathophysiology of this deep diving is the catecholamine surge and vasoconstriction followed by a rebound dilation. And there is a capillary fragility and that causes the rupture. So what does that mean clinically? That means the skin is already compromised, fragile, and vulnerable and inflamed. So in the clinical parallel of this, you see that it is deep damage, and that's what it describes in the Bible. So let's talk about the soft tissue trauma in the Passion of the Christ. So now we're going to deep dive in one of the most violent segments, and that's like the flogging, the scourging. Okay. So the Roman scourging wasn't a punishment, but it was like a pre execution trauma designed to weaken the body to near death, which is crazy, right? And so they used a flagrum, I'm going to spell it flagrum, a flagrum, which is a multi tailed whip, and it's embedded with bone fragments and metal shards. And so, what happens to the body? With each strike, the skin tears, so it causes lacerations. And then they keep on striking, so it's going to reopen previous wounds. And then it causes progressive tissue destruction. Eventually, the skin is no longer intact, muscles are exposed, and bone loss becomes severe. So, the trauma classification of this, the scourging, the flogging, right, is full thickness wounds, possibly extending into the fascia or the muscle layers. So you can compare it to a severe degloving injury, or you could say it's an ulcer with exposed structures, okay? And with something like this, right, with the scourging and the multi tailed whip, let's talk about why it matters. Infection risk, right? The environment includes dirt, blood contamination, and a non sterile field. So it's the perfect setup for polymicrobial infection, anaerobic bacteria, and possible necrotizing infection, which sounds very familiar in what happens in neglected diabetic ulcers. Okay. So when you see somebody come in late, with continuous trauma, that happens, okay? And I mean, I'm from the Bahamas. We used to have something called a cat o' nine tail, and that used to be a punishment, like a criminal punishment, cat o' nine tails, and that was quite severe. Now, when it comes to the Passion of Christ, everybody knows about the crown of thorns. Okay, so crown of thorns, we shifting back to the head. Okay, so the crown of thorns, remember the crown of thorns was forced onto Jesus' scalp. Okay, and I don't think if anybody's seen that episode of the person showing the real crown of thorns, it's thorns all over, and they made sure it was matted down into his scalp, okay? And why does the scalp matter? The scalp contains dense vascular supply, okay, and have multiple nerve branches. So, what would happen if you put the crown of thorns on your head, right, on your scalp? There will be profuse bleeding, severe nerve stimulation, and continuous pain signaling. And the pain analysis is not just a physical injury, it's actually a neuropathic level type of pain with persistent notroceptive signaling. So, it's not just pain, but it was causing pain from the crown of thorns. Now, carrying of the cross, the systemic collapse. Now we're going to enter a systemic physiology of the Passion of Christ, right? So after the blood loss with his flogging, the trauma, the exhaustion, Jesus Christ carries the cross. So what do you think is happening internally while he's carrying the cross? Hypovolemic shock, decreased perfusion, muscle fatigue for sure, and repeated falls, which will also cause new wounds, okay? And the shock breakdown is stages likely involved in the shock breakdown is compensatory, progressive, and irreversible. So that's what happened. The body cannot heal when perfusion is compromised. Now, where we arrive to the crucifixion, unfortunately. So the nails penetrate the trauma and the biomechanics, and so the hands and wrist, okay? They say the hands, right? It's kind of, I don't know if it's a real debate, but I believe they say it's mostly the wrist. It most likely the nails were through the wrist of Jesus Christ. So it damages the median nerve, which will cause electrical shock like pain and loss of motor function. Now, they also nailed the foot, right, on the crucifix. So nails through the feet, penetrating through soft tissue, possibly passing through the tarsal bones. So the biomechanics of it. Now imagine a full body weight body pressing down on nail, because you also have to think of the gravitational forces, right? Through an open wound. And this is continuous trauma with no offloading and mechanical stress on compromised tissue. Okay? So the final mechanism of death when it comes to the Passion of Christ is the crucifixion. The crucifixion kills through asphyxiation. Okay? And so how does it kill through asphyxiation? So it's the mechanics of breathing. So to inhale, you have to push up on your feet and pull on your arms. To exhale, you have to collapse. So what does this do? Each breath reopens the wound, causes pain, and requires energy. And eventually, this will cause exhaustion, CO2 retention, respiratory acidosis, and then resulting in death. Okay? So this clinical interpretation would be multi-organ failure and systemic collapse. And, in deep reflection, breathing, something as automatic as that, becomes painful, just like walking becomes painful in a severe diabetic foot ulcer. Now, remember Saint Longinus, the man who speared Christ to see if he was still alive, right? The spear on the side. What came out on the spear on the side? Blood and water. And they said the man was actually partially blind or blind, okay? And it went on his face. So medical interpretation that him piercing the side of Jesus Christ most likely is from pleural effusion or pericardial fluid, okay? And this confirms that, the death already occurred and the systemic breakdown was complete, okay? So, like I said, Saint Longinus, okay? I always get tongue-tied. But he was a Roman soldier, okay? And according to the tradition, he was a soldier assigned to confirm Jesus' death. He pierced the side of Jesus, and something unexpected happened. He changed. So, the moment of impact, when the spear entered the side, blood and water flowed out. And we already know the breakdown. We're saying it's most likely pleural and pericardial fluid, which is a sign of systemic collapse. But tradition also adds another layer. Like I said, Longinus, okay, had poor vision. They said he was pretty much almost blind. And when the fluid touched his eyes, his sight was restored. Okay, so this is a miracle. And so it's powerful symbolically because this man had a wound and then he was finally able to see through the blood and water of Jesus Christ by piercing his side. Okay. So that says a lot, and I believe he became a saint. They wanted him to deny Jesus, and he died keeping, you know, firm on his belief of Jesus, because remember they persecuted Christians a lot. So and so he was able to see, which is amazing, right? So sometimes, an important case like this, it's the moment the person finally sees clearly. And I guess that's also symbolic when it comes to Christianity and religion, right? We are able to see clearly that he died for our sins and be able to see the sacrifice and, see more clearly in the love of Jesus Christ, okay? So let's talk about the healing paradox. Now we end where medicine had meets a meeting. So, Jesus Christ sustained multiple wounds, the flogging, the crown of thorns, the crucifixion, all of these, but yet he rose again in 3 days and was fully healed, right? So, what clinical takeaways we could take from this? Every wound tells a story. Perfusion is everything. Okay, offloading saves tissue and infection kills, okay? But, this is all about Easter, pretty much a little bit of cinematic wounds. And it was Good Friday. That's all about Good Friday, the crucifixion. So I hope everybody enjoyed this episode of just breaking down the crucifixion of Jesus Christ and the whole reason why we have Good Friday. And this is Diabetic but Files, where wounds speak and we listen, and take care of your feet because they take care of you.